Viewers, Assalamu alaikum. I'm your host Faisal Raza Khan and you are watching Foresight. Viewers, Pakistan's north, especially Punjab province, is grappling with the dire consequences of air pollution, especially smog, which has evolved into a multifaceted crisis encompassing social, environmental, economic, legal, regional and international dimensions. The alarming reality is that thousands of people, livestock, wild animals and bird species are suffering due to the devastating effects of air pollution. Experts cautioned that despite temporary respite from shifting wind patterns, natural and artificial rain, the issue persists. In response, the Punjab government already announced and in place the 10 years plan to tackle climatic changes and air pollution. Along with that, a 16 points action plan already envisaged. Lahore High Court has also sought the Beijing smog control plan. And now the hearing would be the next week. Air pollution and smog has severe health impacts, environmental degradation, economic consequences. While it needs awareness, the public support, strict implementation of regulations, renewable energy, green industries, electric vehicles, reforestation and afforestation. To talk on this very important issue of today's world, and particularly when Pakistan is going through this critical juncture. We have in our studios Dr. Nuzhat Khan. She is the public health consultant and with us in studios. Thank you very much, ma'am, for being with us here. And with her, Dr. Kashif Majeed Salik. He is the research fellow at Sustainable Development Policy Institute. Most welcome to you, Dr. Kashif. Thank you very much for your presence. And online joining us, Ms. Zainab Naeem. She is expert in circular economy and she is right now there in Baku, Azerbaijan, and attending a conference of parties, the 29th session of the United Nations Climate Conference. Most welcome to you, Zainab. Thank you very much for joining us. And my first question to you, how do you see this, the first time ever the Punjab government implementation of the 10 years implementation plan, particularly related to the climate change and air pollution to tackle all these issues, especially the smog one, including 800 brick kilns have been demolished, the transitioning to the rest of the brick kilns to the zigzag technology, introduction of the e-bikes and e-buses, provided at least 1,000 super seeders to the farmers at 60% of the subsidy price to end the stubble burning. How do you see this initiative by the Punjab government right now?
Hi, thank you, Faisal. I think this is a very brilliant initiative, and this has been taken for the first time to actually mitigate the smog in Pakistan, especially Punjab. I do appreciate this initiative, and especially the step-by-step phasing out of the air pollution. As you have mentioned, it's very critical for addressing this challenge in Pakistan, in Punjab. As far as the steps are concerned, especially the green lockdowns, and again, the complete lockdown was also implemented because, of course, we have to keep our people safe. So the government is proactively managing and trying to control and mitigate the actions that are contributing towards the smog issue in Pakistan and Punjab. As far as other initiatives are concerned, I think this is a very widespread issue, and this is an issue on which up to certain level the government can take control and can help to manage. But overall, it has a transboundary nature as well. So for that, more measures will be required. But for the current state, if this step-by-step initiative, it gets implemented properly, then over the next 5 to 10 years, we can observe smog mitigation and we can see the reduction in the air pollution that's causing this issue in Punjab.
Your point well taken, Dr. Kashif. For the time being, the smog issue subsided to some extent due to the change in the wind direction, or you can call it natural or the artificial rain in some areas. But many experts still believe that the air pollution issue still exists and could become a serious issue as the cold weather and the fog going to increase as far as the winter situation is going to be intense.
Yeah, thank you, Faisal, for taking me in your program. Actually, the source of pollution is still there. So, if the wind patterns has changed, and there is a wind is blowing and they're taking away the smog, but the sources are still there. So, I think until unless we not reduce their sources, we can't get rid from this smog issue. So, we need to work on transport sector, agriculture, and also the climate part, which will talk later, that how this climate change is impacting the smog issue, and how geography, particularly the Lahore and the adjoining areas, actually trap the dust particle, and that's the permanent issue that caused this smog issue,
making it more intense.
That's why there is less smog issues in Karachi or other parts of the country, but there is more in Punjab. That was the geographical lock-in, where the dust particle, dust storms running through the winters, and that's trapped in the Himalayas, and just caused that impact.
Your point well taken. Dr. Nuzhat, you have ample experience when it comes to the public health and medical conditions. So how much smoke and air pollution is a serious issue, as in just 1 month over 2 million people have been suffered from the respiratory diseases across Punjab. According to the Health Department of Punjab, more than 1,26,000 cases were only from Lahore. So how to tackle the severity of air pollution to avoid any sort of health crisis?
Thank you very much for having me here. To me, this situation is a very serious public health issue, and we also call it the financial burden. Many a times we term it as a financial burden, because so many people will remain out of work during this period because of illness, because of other reasons. And I see a very serious impact on the next wheat crop. As more people are falling ill, the workforce is going to be lesser and lesser, despite the fact that it affects the women and children more, and women are a huge contribution towards wheat crop.
So your point well taken. Your point well taken. Dr. Kashif, what about the need of high-tech air quality monitoring and the surveillance systems across the country, especially in Punjab? As only Punjab needs more than 30 such systems. Do you not think that it's a high time to invest in protection and enhancing the quality of the human life through technology?
Yes, of course. Technology should be there, and I think for air quality monitoring, we need to invest more in technology. But there are other issues, particularly the non-technology part, where we can easily get rid of this smog issue, particularly the implementation of the policies, very well drafted policies, just like the Clean Air Act and environmental policies. They have very well drafted, but the implementation size need to be enhanced, and capacities and trainings need to be enhanced. So, for example, the crop residue burning, which is very severe during the winter. So, with some non-technical or non-technological methods, we can just manage that things to control. There are a number of issues, ways where we can control it. Number one is the local governments. So, might be we can give this assignment to the local government, the single point assignment, that they reduce the air pollution in terms of changing the behavior, changing the control of the farmers, that they stop burning their residues. Also, another important point is that the panchayat system, which is loosely still prevail in the Punjab, but we need to organize the second tier of the local government, where the farmer need to be organized, and they set accountable for burning these crop residues, and also providing them the alternatives. So,
So we'll talk on those
Yes.
alternatives as well. Dr. Nuzhat, what about the lethal effects of the air pollution and smoke, like respiratory infections, especially in infants and children under 5 years of age? UNICEF alarmed that at least 11 million Pakistani children are exposed to the high level of pollution, particularly under 5 years of age. People with chronic diseases, the pregnant women, elderly are also extremely vulnerable to these effects. So how do you see that?
Well, I see this as a very serious issue because there is no protection. When smog is there, nobody is protected. The air inside homes also is as bad as outside. So you have it. And as for the vulnerable groups or the high risk groups, I'm very concerned. Our children are very, very vulnerable to the respiratory disease caused by smog. Now, over here, I'll try to clear this, that smog and the residues in the air are two different things. Smog is different, and we have to, this has a very high rate of particulate matter, and not as much of the poisonous residue which is there all year round, which is the cause of burning crop stubbles and factories and many other things, which I call the VOCs, volatile organic matters. So they are all there. This season, the smog season is totally different. It remains, the particulate matter remains very low, and people are bound to inhale it. There's no escape from this. You have to be inhaling this.
So as Dr. Nuzhat is saying, actually, Dr. Kashif, though the crop burning is an issue which is intolerable, but its proportion is lower than that of the vehicular or the industrial emissions, as they both contributes at least 45% and 40% respectively to the air pollution, especially due to the use of extremely substandard fossil fuel, low quality petrol and the coal quality. So how do you see this important area? Because this is the main reason why the whole of the cities are grappling, and they are breaking the records of having air quality index beyond 2000.
Yeah, I think we need to go for emergency situation where the Council of Interest actually look into the matters and provide support to the provinces. So one way of looking is to the supply side, where the manufacturing.
You are talking about Council of Common Interest,
yes,
CCI.
yes. So one way of looking is the supply side, where the manufacturing sector, like just automobiles and other that they're producing motorcycles and cars and all other
emissions they are producing.
So we need to control their standards, the two-stroke engines, the quality of the manufacturing. So one side is that we need to reallocate the standards or reassign the standards to that industry. The second important thing is the supply side, where the people's behavior need to be checked in, and the approach toward pollution, either it's waste pollution or either air pollution, we need to change the behavior of the people. My suggestion is to develop the service industry related to the smog. On the one side, they provide services to the farmers, to the transport sector in terms of technology, in terms of expert opinion, in terms of trainings, and the use of alternative energy fuels, biofuels.
We are going to talk on those alternatives as well, but Zainab is with us right now. Zainab, do you not think that the special measures must be taken to control the dust pollution, transport of the construction material, environmental impact assessment, the strategic environmental impact assessment and environmental management at a different construction site, especially when it comes to the irregulated and sometimes the unlawful real estate development across the country, because that is ultimately squeezing the agriculture farms, even the deforestation, and even that is clearing our mountains and lots of valleys. So how do you see overall this phenomena which is going on in our country, and that's why that is the main contributor also to the air pollution when it comes to the dust and the construction industry?
So, Faisal, there are two things. First and foremost, that I would like to mention, after 2016, there was a lot of work at policy side in context of air pollution and smog. We got the policy, and very latest is the National Clean Air Policy of Pakistan. And within that policy document, if you go through it, there are very effective measures are mentioned already. For example, converting the transportation, especially the vehicles on Euro 5, Euro 6 standards to reduce the emissions, and then also controlling the brick kilns emission and everything. So that's mentioned, and the government is trying to cater that issue of air pollution. Apart from that, your question regarding the EIAs, yes, the private sector housing societies, that's also one of the contributory factor towards this deforestation leading towards air pollution, and climate change has a direct impact on air pollution. So controlling this expansion in the cities is very important. Green spaces, that are the buffers for the city. They act as the lungs for the city. So in opening more green spaces, creating more green spaces can help us to mitigate smog. And for example, the government took this clean green initiative of creating the Miyawaki forests in the urban areas of Punjab specifically. So that's very helpful for mitigating smog. Apart from that, as per the Section 12 of Pakistan Environment Protection Act, EIA is a must whenever any construction project is being taking place. Although we have an EIA process and NOC needs to be issued by the Environment Protection Agency and departments, but I think people are not much aware of how this process should be done properly so that environment doesn't get harmed. For that, community awareness programs should be developed along with the steps that the government is already taking, and aggressive communication strategies using mainstream media can be the key for providing solutions towards smog mitigation in the country.
Yes, definitely, you're absolutely right, because Pakistan Environmental Protection Act 1997 urged to have EIAs and the SEIAs, but unfortunately we haven't seen much of the focus regarding the construction sector. Zainab, in Punjab and elsewhere, authorities are facing issues of traffic and transport jurisdiction, fragile interprovincial coordination, then fake fitness certificates of the different vehicles, old obsolete motor vehicle laws, and the staff shortages. It hampers actually the efforts to curb vehicular emissions, especially in case of unfit and even 70 to 80 years old vehicles are running at our roads. So how do you see overall perspective, because smog is not only an issue it is not limited to environment. It is now the social issue, the legal issue, the economic issue, and it is whole of the thing right now. So how to tackle such an issues which are pertaining to the transport right now?
So, Faisal, 2 years ago, there was a report by NASA, and within that report, a map was, projecting how vehicular emissions are creating havoc in this region of Indo-Gigantic Plain, which is Indian Punjab and Pakistani Punjab. So, air pollution, that's being maximum contributor factor is the transport sector, because the old vehicular emissions, they emit emissions that are NOx, so nitrous oxide emissions, and when they're released in the environment, they create this environment air pollution issue. So for that, strict measures and strict check and balances on old vehicles should be implemented. Although government is now imposing heavy fines on people with old vehicles which are emitting these emissions. But apart from that, we have a metro bus, we have BRT systems now, but I think more such initiatives should be launched. Apart from that, another initiative that can support the government's plan is the carpooling. If the government starts taking ownership of this initiatives around carpooling, where more people can utilize one vehicle to commute to their workplace and others. So I think that can also add on to whatever the government is already doing in context of mitigating smog.
It is again a civic sense that how the citizens behave, because every individual has if every individual has the 4 cars, so it is going to be really unfair to talk about the air pollution really. What about the Punjab government's program regarding the mass transits and the bio-industry program, that also the emission control and to have oxidizers and the green technologies implies to destroy the pollutants before releasing into the environment or into the air, and to attain this objective, factories are being assisted by the subsidized loans. So, do you think that this is going to be add some sort of a relief into the air pollution, and there would be some sort of a clean environment in future?
So, Faisal, yes, pollution control technologies can help the factories to limit their emissions. But let me be very clear and share a fact with you. In Pakistan, factories' emission is not the leading contributory factor towards air pollution. It's mostly the urbanization, the deforestation, crop residue. Burning is also, that takes place between September, October, and the start of November. But now that's not the issue. The issue is vehicular emission, transportation sector. So in that context, the BRT system, it can help. But again, your point, civic sense is very important, and awareness among public is very crucial to help the government to support them for implementing their plan. So as I said earlier, this plan which is being implemented now, we will see its fruits in next 5 to 10 years. Smog issue is not an issue that the government can solve in next few weeks. That is not going to happen because the transbound.
Your point well taken. Dr. Nuzhat, several studies reveal that the atmosphere filled with the pollutants, including the dust and the toxins, dense smoke and the chemical fumes, trigger acute respiratory diseases. The severe mortality rate in non-ventilated patients, or those actually suffering from the chronic lungs diseases, including the asthma, etc. So how do you see this whole phenomena?
I'd like to be clear about what do you mean by non-ventilated patients? I mean, is the mechanical ventilated?
Not mechanical, even the technical, because the patients who were earlier with the COVID-19 disease, they have some sort of a breathing issue, or some sort of asthma patients who have some sort of a breathing issue. So like the chronic patients. So do you not think that if they don't have much oxygen available in the air, so they are going to be critical, or this is going to be the critical respiratory condition?
It's not a very ideal situation. Ventilators, I mean, the most Punjab hospitals do not have enough ventilators to provide to people who really are in need of mechanical oxygenation. So, I mean, the biggest hospital have hardly from 5 to 8 ventilators, and the number of patients is very high. Lots of measures have been taken in the hospitals to deal with the emergency, especially for the children, like nebulization, and nebulization is good enough. For children, it's good enough if it is done in time, is done properly. And but most people don't get there. I mean, Punjab is a huge populated province, and the majority of the population lives in Lahore, but there's a huge number which lives outside Lahore. So what about them? And this time around, I have noticed that the smog level does not contain to the big industrial cities. It's everywhere. It's in the rural area as bad as Lahore. I have seen it myself. So, I mean, the rural population living in rural areas, and there's a huge number of children under 5 who live in those agri districts or villages. So, they don't have access to anything. That's absolutely zero facilities.
So, what are basically the effects when we are talking about the particulate matters, nitrogen dioxide and the sulfur dioxide? What ultimate effects they have if somebody hails it? Because that inhaling, especially regarding the respiration and the heart and the neurological effects, or what actually happens to those?
One more thing I would like a bit clarity on. The neurological disorders or disease is not caused by smog. it's caused by the many different poisonous gases which are emitted in the air. I'll quote one like lead. There are so many diseases and disorders which are caused by high level of lead, and there are so many others. So I'll come back to this. Nitrogen oxide is a normal component of the atmosphere.
Okay.
Why like right now everything is kind of haywire and not really doing its job, that atmosphere is totally disturbed. I mean, with all these gases, is living in those gases is like living in a bubble. That is a covering bubble. It protects us with oxygen, with nitrogen, with hydrogen, and so many other gases, argon. They are all very good gases. I mean, we can't live without them. It is only when this level is disturbed and disease is caused. And respiratory disease is not the only thing that should be taken care of. People with chronic illnesses, and especially cardiovascular disease becomes worsened during this period, because they are already, their oxygen level is already compromised. So with whatever oxygen they are trying to live with is further cut off. So I mean, I have seen people going into cardiac emergencies and even fatalities. And same goes people with pulmonary disease. I mean, they have very little chance to survive in these conditions.
Your point well taken. Dr. Kashif, Lahore was once called the city of gardens, the Multan as a city of mango orchards. But now both cities along with other across the country give deserted look. Pakistan has already less than 4.8% of the forest cover, lost at least 20% of the forests in last 20 years. 27,000 hectares we are losing every year when it comes to the forests. So Lahore alone must have 36% of the green cover, but it is only 3%. So do you not think that the government should impose some sort of reforestation or afforestation emergency under the Green Pakistan initiative?
I think it's important, and the statistics you mentioned is critical actions. Critical actions are required, and about 87%. My statistics show that 87% of vegetation in Lahore has lost over 3 decades. So it's a huge number, and also we have just 1% forest cover or the tree cover in Lahore. So there is a huge scope over there to for the afforestation efforts in Lahore. And I think for this, government alone cannot act properly. Civil society, schools, colleges, and other groups in citizens of Lahore or other areas in Punjab, like Faisalabad, that need to come up. And with these efforts, we need to grow more trees. And
so when it comes to the air pollution, particularly the smog, it defies the borders and the geopolitical tensions drifting freely from one country to another. So creating the extreme regional crisis and endangered millions. Do you not think that India, beside politics, should think about saving lives, the health, environment, extend cooperation, tackle shared emergency through climate diplomacy, and have a meaningful dialogue when it comes to the environment, particularly the air pollution?
Yes, of course. I think it's very important for the Punjab government is trying to talk with the Indian Punjab government. So government to government and also the civil society to civil society engagement is important. We have actually some engagement with the farmers, Indian farmers, what they are doing with the crop residue. We recently published a report, and where we gain insight that what the Indian farmers are doing with the crop residue. They are doing multiple organic ways of crop residue management actually. So one of the ways is mulching, and they also use different happy seeders and other technologies. And our farmers, because of they are mostly small farmers, they have financially constraints. They are actually burning their crop residues. So challenge is to learn from each other, of course. Political things are aside, but that's the health issue, that's the survival issue. And I think we should work together to have a.
Definitely, your point well taken. Dr. Nuzhat, what you suggest to the citizens that about nebulizing, about regular checkups, have the X-ray or chest X-rays particularly, to avoid any sort of complications when it comes to the smog or the air pollution of such level which is right now prevailing. Identifying the respiratory infections, because most of the infants like pneumonia, that is young children and the pregnant women, elderly, especially with the chronic cases like we have already discussed, the asthma or the pulmonary disease or cardiovascular or past COVID-19 survivors even. Most of the people can't maintain their oxygenation levels but due to the various medical conditions. So how, what you suggest actually to the citizens that how they have to behave medically?
Over here, my target will be the majority population which lives in the rural areas or suburban areas. They don't have access to proper medical care. So they have to do with the prevention. The prevention is to stay indoors, not to go out unnecessarily, or at least use masks when going out if they have to. And if there is a respiratory infection or something like that, then they must resolve to matters like nebulization or simple plain water inhalation, steam inhalation of plain simple water. These are the measures that they can easily apply, and it works. I have seen it works.
So if somebody, because most of the people are working, students are going to the schools, colleges and universities, there are lots of working women as well. So if the people go out with the mask even, what should they have to do when they return home?
Well, it is about basic hygiene. Basic hygiene really plays a very big role in this. The moment you enter home, you go to the toilet and rinse your throat and clean your nose. That is good enough to eliminate much of the pollutants that you have inhaled.
And especially
during
to do care
travel.
your eyes as well. Washing
yes,
hands is also very much important.
Exactly.
So, definitely, your point well taken. Dr. Kashif, how much people support is inevitable to implement these decisions what the governments have already taken, even the federal government might be, or definitely the Punjab government, the plan to combat air pollution in a sustainable way. That is the crux now. Yeah. Because when it comes to replace even 20 years old vehicles, vehicle fitness regimes, promoting an efficient mass transit system, use of the public transport, banning the crop or waste burning actually, and developing green industries, all required the genuine public support.
Yeah, I just talked earlier that these efforts are excellent efforts, but that need to be year-round efforts, just not for the 2-3 months. So one is the consistency of your efforts. You just doesn't stop after the fog is over, smog is over. So one thing is this. Second thing is the research and development. The research we actually we think that we have enough data, but right now who is polluting where and who is getting affected and who is actually more dire need for the medical, for the economic support, and how much is impacting our economy.
Definitely.
And so that actually need to be studied. And for example, there are a number of dashboards that are monitoring the air quality. So another dashboard is required for the industry, for the transport sector, where the emissions is coming out, and also the link with the climate indicators, that how this emissions from the transport sector, from industrial sector, from the agriculture sector are linked with the climate change and what is going in the future. So, futuristic approach is required and year-round efforts. So, that is important. And third important thing is the private sector. I think as I mentioned earlier, we need to develop the service industry for tackling these smog issues. Either it is for the agriculture, we need to develop the market for the crop residues, the rice residues, which so we need some economic model for them, bring young people as an agri-entrepreneur so that they develop, they get business from these crop residues, and they use this for different purposes, industrial purposes. So that rural economy or agro entrepreneurship need to be developed. So market, so that type of things actually help us to combat this issue. And also the most important thing is to in the research is to study the case studies for the London 1950s or 60s, where the similar issues happen in London and similar in China. So we can learn from them that how they combat with this.
I'm coming to China, as well. But Dr. Nuzhat, when it comes to the infants and the underage children, particularly under 5 years of age, because they are actually nourishing, they are growing. So in that age particularly, they are going school, they are playing in the grounds, in open, and when such a circumstances are there, they are children, they are not caring most of the times. So how much important the role of the parents and the teachers, who are actually the guardians during their school time and during the when the children are at home. So how to tackle those children to avoid any sort of a medical consequences in future?
Are you asking me that if one of the students at school goes through a respiratory emergency, what should the teachers do?
Definitely.
Yes, teachers should be trained for that. Teachers should be, and they should be, this is not a very expensive object to have a oxygen cylinder with a proper set that is used to inhale the oxygen, functional one. No, because I have seen oxygen cylinder with a non-functional set, so that's no use. So these, and if a child, I mean, simple oxygenation is good enough. It saves life. I mean, 5 minutes oxygen inhalation actually can prevent death, fatality. So this should be made available in the schools. And at home, well, I mean, if you want me to comment about the privileged society, so they can keep their children inside and they have purifiers.
Even the underprivileged people, because most of the times they are living in rural areas, they are living in slums. Or
yes, that's our majority of population.
Definitely.
Yes, that's where our majority of these 11 million children, perhaps the 8 million are the ones that you are talking about.
Definitely.
So, and villages are dusty and polluted all year round, but they kind of survive. But this season really comes hard on them. So the lady health workers are available in every village, or at least a couple of villages.
Because from nowhere smoke is coming everywhere really, because the people are suffering right now.
Yes, exactly. So at the grassroots level, we have this army of lady health workers.
Yes.
And they should be mobilized, they should be given extra funds. If they are looking after more than one village, then they should be given transport or some kind of security, motorbikes to one of their family member, so she can go around, and she has the basic training how to meet a pulmonary emergency. So she can handle this.
Definitely. Means the lady health workers can do it because they are trained for that.
Exactly.
So you are absolutely right on that, and I think so that they are the real catalyst in our rural areas, even at in the cities. They can do that, and they could be very handy on that. Dr. Kashif, you were talking about China. China is Pakistan's very fast friend. So when we are talking about the examples from China, Lahore High Court recently asked the Attorney General Punjab during the last hearing on smoke, basically, to assist court on Beijing smoke control model. So, and submit an implementation report as well. So, what's actually the Beijing smoke control model? How China has done that?
I think the strongest part is their research. First they did the research and then identify the main polluter, the main causes, and then they developed the standards and then implemented it with full force, and so that's way first need to identify the main polluters and then the impacts, and impact is social, economic, culture, whatever the impact you come up with the research, and then there is a long term and medium term strategy. There are some short terms, just like the smart lockdowns is there, the Punjab government is doing. It's a good effort to reduce the immediate impact, but of course there is need of medium to longer term impact. And I was looking into the program. It's very well drafted, the Punjab 16-point and the 10-year plan. So issue, my suggestion, my understanding is that how we can implement that plan.
Definitely.
So
definitely.
my suggestion is to go for the local governments, engage the people, engage the local, because this is where
you are absolutely right, because without engaging the people, it is impossible to implement those plans at the grassroots level. You are absolutely right on that. We have run short of time. Definitely, you have lots of ideas. Thank you very much, Dr. Kashif, for being with us here in the studios. Thank you very much, Dr. Nuzhat, for your time. And we are also thankful to Zainab, Naeem as well from Baku, Azerbaijan. She has spared time and have a very candid views. Viewers, you have just listened to our panelists. It is important that we have to just understand that pollution, air pollution or smog is one part of that air pollution, and that is creating a kind of a health emergency. That is basically an issue of environment, the economy, the law, the issue of, it is also a social and economic issue. So we have to understand that we have a responsibility. Every individual, every citizen must have a civic sense. We have to obey the country's law. When it comes to the Punjab government 10 years plan or the 16th action plan, it is all about that citizens have to implement it. We have to learn it, that we have to live with it, and we have to live with dignity, and we have a right to have a clean air. That is embedded in the Constitution as well. But we have the responsibility. When it comes to the rights, there comes responsibilities as well. We have to show this responsibility that we are the law-abiding citizen, and we have a care for Pakistan. So we have to care for Pakistan and care for ourselves as well. When it comes to the health issues, we have to save our children, our women, our elderly, and the people with the chronic diseases as well. We don't have to expose ourselves more into the open environment. When it comes to coming back to our homes, we have to wash our hands and we have to cleanse our faces, and we have to take care of our eyes as well and shut the windows. We have to be very careful on that aspect as well. But when it comes to Pakistan, we have to care for Pakistan as a true law-abiding citizen. This is very important. And when it comes to overall implementation of law and rules and regulations, again, we have to be very responsible citizen for that. This is today's Foresight. It's time to sign off. Allah Hafiz wa Nasr.